COVID-19 is changing how we live, work, and connect with others. Imagine trying to be a caregiver for a loved one that is living with dementia. Today's CI Health sponsor is the Alzheimer's Association Illinois chapter. We have Daryl Carlson joining us, Manager of Education and Community Volunteers for the Illinois chapter. Daryl, thank you so much for being with us today.
My pleasure. Thank you for having me.
All right, let's talk a little bit about tips for caregivers who may have a loved one with Alzheimer's or dementia. What are some things they need to be aware of?
Well, I think, some of the things they need to be aware of are things they should normally be aware of, but just a little bit more vigilant of it because of the situation we're in. So, of course, when it comes to just health and cleanliness, just be more vigilant about cleaning up, knowing that your loved one is going to not be as likely to remember to wash their hands or to be cleanliness that way. Maybe posting signs in the bathroom with pictures of, wash your hands and someone demonstrating that might help them as well. Taking care of the caregiver, taking care of themselves, because your stress level can definitely influence your loved one who has dementia. So you want to watch that as well. You want to know that there are other support options out there. We're always there for you with our 800 helpline. If you ever have any questions, please feel free to reach out to us in that way as well. And just know that with your loved one, if they have any other chronic conditions that are going along with this Alzheimer's or dementia diagnosis, they might be at a little bit more of a risk of being more vigilant in that respect as well. Although, because you have dementia, that in and of itself doesn't mean you're at more risk. But if you have other health conditions, that might make you more at risk as well.
Something else I'm thinking of is, we're trying to practice social distancing and keeping 6 feet apart from one another. Obviously, family members excluded, but a lot of these families that have caregivers coming into the home from outside resources, what kind of precautions do we need to be thinking about along those lines?
I think for certain you want to make sure that, well, first of all, if they're coming in and they're wearing a face mask, realize your loved one may be really upset by that or not sure what's going on. So take a few extra steps to explain why that is or why they're wearing that mask. Make sure, any surfaces they bring in, you clean, and just extra cleanliness like that. And of course, depending on the situation, I'm not sure if they need to come in contact with your loved one or not, but just using your good common sense and the CDC guidelines, or you want to keep doing that as well.
Something else I feel may be a challenge for families with loved ones with Alzheimer's is we've been hearing lots about nursing homes being shut down and family members not being able to visit. I'm assuming the same goes for these daycare type services for, patients with Alzheimer's or dementia. And that must be hard for the caregiver as well as the patient.
Yeah, absolutely, because some of the resources they normally had access to, they now don't have that. So I think caregivers should be become more comfortable with asking for help. Sometimes that's hard to do. Of friends, of family members who maybe aren't living at home. Are there other things they can do to help you? Can they go get something and drop it off for you? That's one way. And then if you have a family member who's a caregiver, maybe you're not doing that yourself or a friend, be proactive, reach out to them, check, make sure they're doing okay. Social distancing doesn't mean social isolation. So give them a call, see if there's a way that if they're used to Facebook or other, video conferencing, see them, talk to them, see how they're doing.
And a lot of these daycare services are possibly shut down as well. So any advice for those families to maybe navigate this time of, the shutdown, who may take advantage of those services?
Yeah, just make sure you take care of yourself. Give yourself the breaks that you need to have, because primarily thing is for those services that give the caregiver a break, but then also try to be proactive and come up with some other ways to help engage your loved one who has dementia. Sometimes a simple activity that you're doing, you can find a way to help them do that with you as well. So if you're washing dishes, you can give them a simple task of putting the silverware in the drawer, or just dry the plate and put it up, or whatever it is, just small, simple things they can do to ways to engage them so they feel like they're a part of what's going on, but then it's not stressful for you. So finding other ways to keep your loved one busy at home.
Yeah, and I know being a caregiver, it's challenging in and of itself without a pandemic to deal with. So it's nice to know we have resources like yours to help people get through this time. So we appreciate you phoning in with us and sharing some tips.
And thank you very much. I'm glad to do it.
Well, if you need any more information about the resources available with the Alzheimer's Association Illinois chapter, there's a look at their website, and we will be happy to share that at ciliving.tv. Daryl, thank you so much for joining us today.
Thank you.